Good evening, everyone, and welcome to tonight's live as part of our Pharmacy 360 series on social connections and relationships. Tonight, we are going to be talking about that very important relationship with ourselves, and I'm really excited to invite on Dr. Louise Fitzgerald. She is a GP that specialises in women's health. She's worked in lots of places, but Grafton Medical. She goes by the menopause doctor on Instagram. She is working in the Avoca Clinic. I know Joanne McNally gave that one a big shout out on her podcast last week. But Dr. Louise is full of knowledge, and we're going to do a deep dive into a talk all about the relationship we have with ourselves, but how it changes all the time, particularly for women, like through the decades from our 20s to 30s, 40s, 50s, 60s, 70s and beyond. We really do change a lot physically and emotionally. So I can just see Louise is coming on here. Also a co-host on a podcast on Spotify called Lady Bites Podcast with two other of her GP friends, where they discuss loads about women's health. And hello,
hey.
Welcome on, Louise.
Thanks for having me on.
Just giving a little brief intro on you there, as we did the technical side, but it wasn't too bad tonight.
Seems to work out. That's great.
Yeah, thanks again. I know it's probably not too tedious being on today, as the weather has changed for us, unfortunately. But look, maybe we needed a break from the sun.
It's good.
Yeah, exactly. As I was just saying there, as part of Pharmacy 360, we're always looking at lifestyle when it comes to health promotion, which I know you're also a big advocate for. And the medication is great. It's life-saving. It's amazing, especially when we see like how much HRT has taken off in the last 10 years, really, and helped so many people. But you and I both know that it's in collaboration with lifestyle factors for people to really get the best benefit for their health. So I know we've planned a little chat today, but it's really about that relationship that we have with ourselves and our own bodies. And I know you are specializing in women's health for quite a while now. You're really passionate about it. And what do you see when it comes to, patients in front of you? What are the main topics that come up when it comes to like how they feel about their own bodies?
Well, first of all, thanks for having me on. It's really lovely to be on. And I like that you picked this topic because a lot of people ask me to talk about menopause and just menopause. But I think this is such an important conversation to have. And when you mentioned to me a few weeks ago, I was thinking about it, and I was thinking, in some ways, it's a challenging conversation to have, and it challenged me a little bit. And it made me think of myself as a doctor, but also as a person, and the expectations that I have as a doctor on somebody in terms of their body, but also how that compares to someone else's expectation when they're sitting in front of me as a patient or as a person. But then also the expectations that I have on myself, on my body, because obviously that's a relationship as well. And I think as doctors, we're seen as pushing for healthiness and caring for your body, and that is really, really important. But it's more about the approach to that rather than just like the physical gains to get there and the numbers on the scales. And I love the quote, "Don't let your mind bully your body." And I think that's particularly important when it comes to women, because we know that 9 out of 10 women would like to have a different body, which is astonishing numbers. And 8 out of 10 women feel their lives would be different if they had a different body, specifically a slimmer body, because it would be given them the confidence to follow their dreams. And they're pretty alarming statistics. And for me, what I think is really important is that as we change and as we age, we don't actually lose ourselves. We actually learn more about ourselves. And getting to know yourself isn't like a one-time achievement. It's like a lifetime conversation. And like what we're talking about, the conversation we're having this evening is about our relationship with our bodies. But really, if you think about it, it's our mind's relationship. And that's a two-way conversation, because often our inner voice is quite critical. And if we can kind of shift that inner voice and shift that dialogue from criticism to compassion, then you can kind of work collaboratively with your body, which is really important as a doctor, because if a person can't work collaboratively with their own body, it's very hard to work with that person as well.
Yeah. It's like that inner coach versus inner critic. Like, how do we act like our own best friend? Because if one of our friends came to us and said what we're saying to ourselves, they'd say, "Don't dare say that about yourself." Like, that's so mean. But we do it. We do it over and over.
And what I say to people is, when you get up in the morning time, because I think that's probably one of the worst times, we get up in the morning time, we look in the mirror and we start feeling our squidgy bits and we look at ourselves in the mirror and immediately negative thoughts come into our head. But I think if you can, when you're looking in that mirror, maybe you don't have to think positively about yourself, but to think neutrally and even identify something about yourself that you like about yourself. Maybe it's your hair, like feel your hair, or put on your lipstick, whatever gives you that little bit of confidence. And then asking yourself, what is it that my body needs? As opposed to what is it my body owes me? Because at the end of the day, we only have one body to work with. So giving our body what it needs is really, really important. And then that brings you right around back to what advice we give as a doctor as well.
Yeah, well, so it would be a great way if, like, it's a great piece of advice that I hope some people take from it. Some people I know put like post-its on their mirror as little reminders. So whatever it takes.
Yeah, and I love this quote, and I wrote it down because I can never remember it, but I wrote it down, and it says, "The body holds the story, but the mind is often the narrator. If we want to feel happy, we might need to tell the story differently." And I think that sums up that conversation. That's our mind-body conversation that happens with us every day.
Yeah, and tell a nice story. Think Disney.
And as you said, it comes back to self-compassion. And self-compassion, people often say, well, what is self-compassion? But it's, what would you tell a friend?
Mm-hmm.
Friend said to me, well, I really feel fat after I had my baby. You wouldn't say to them, yeah, you'd be saying, well, look at the baby you had after that 9 month journey to get there. And I see this a lot in practice. I see a lot of women coming in and they say at the 6 week check, I'm not back to normal. Because the last time we see women is at the 6 week check. But if you think it's taken you 9 months to get to that point in time of having that baby, it's going to take you 9 months, if not 12 months, if not, I think, 2 years, really to feel yourself again. And that might be a new self,
Mm-hmm.
well. And especially if you've had maybe, some medical issues as a result of delivery. But again, it's going back to being self-compassionate and not hard on yourself.
Mm-hmm. And how can we try to accept where we're at and not always want to have that figure I had in my 20s, or like be able to fit into those clothes I used to wear 10 years ago and I can never wear them again? Like, just have you any advice for people from what you've seen, like how to accept where you are now? And like, I suppose it comes to gratitude, really, like be grateful for all those steps you've taken to get to where you are.
Yeah, I mean, I think, a lot of people, acceptance is like a losing word. It's kind of giving in.
Mm.
But if you accept things, you can then work with your body rather than working against it.
Mm.
And I'm saying that I have clothes in the wardrobe, that I want to be able to fit into again. And I have clothes in my wardrobe that I want to be able to fit in again. But our bodies change. And I think understanding why our bodies change is really helpful as well, because I think we can be more empathetic on our bodies once we understand why bodies change. So that change over puberty, or in your 20s to your 30s, or going through your fertility journey, you can see a lot of body changes with that. Or as you have a pregnancy and a delivery, and then into perimenopause, menopause, and the postmenopausal period. And I think if you can understand why your body changes, and I think that's really important to explain to somebody, then you can sort of accept that change. And coming back to that gratitude piece, like, I think gratitude is about shifting a focus from what's missing to what's present. And actually,
Mm-hmm.
you feel and understand what's present, and feel present yourself, then you feel more confident.
Yeah.
That's really important as well. Trying to focus on what you have, and not what you don't have. And that is very much in terms of everything in life, but particularly in terms of your own body.
I think especially at the end of a long, busy day, to just find like one, two, three things at the end of a busy day that you are grateful for, because often by the time you get to bed, you're just exhausted, and it can feel like that the day like was just a bit of a mess.
Yeah.
Whereas if you actually rewind and just literally take like 5 seconds to think back, say, well, hang on, actually, this that happened today. Like that nearly feels like last week at this point, but that was today. And it was actually lovely. And, just to actually remind yourself of something good at the very end of the day, actually, we know that actually changes the chemicals in your brain. Like it's science. It's proven to help your focus be more positive than negative. And I love that what you have rather than what you're lacking, you know?
And also, I think, as I was doing, because I have a podcast called Lady Bites Podcast, and we were interviewing Dr. Kira Balviso last week as part of Mental Health Awareness Week. And she was talking about mindfulness, and mindfulness is something I really believe in. And I used to see it more as being like meditation. I used to do meditation. Now I don't do so much meditation anymore. But mindfulness can be something, and she described it really well, as simple as zesting your orange. It's all about the smells, the feelings, the sensations of it, the juice running down your fingers, the orange on your skin. And for me, what I find quite mindful is actually cleansing my face in the evening. I don't do it every evening, admittedly, but I find cleansing really, really therapeutic, really mindful, because you're focusing on that. It's usually a moment where I'm in the bathroom by myself. My daughter's gone to bed and she's asleep. So I'm in the bathroom by myself, and it's the smells and the feeling and the warm water, and the focus, and just focusing on something that is not, there's millions of thoughts that are going around in my head, and that list of things I need to do, and what's going to happen the next day, and what do I need to be worrying about with my daughter and my life. But it's just those, and it's not, doesn't take long.
No.
2 minutes. So I think if you can find something that is mindful to you, and it's
Mm-hmm.
a meditation, or something that's learned, it's
Yeah.
something you're doing every day. Like Kira was saying, when you brush your teeth, the smell of the toothpaste, and the feeling of you brushing your teeth and then
Mm-hmm.
pushing out your mouth, like that's quite mindful.
Yeah, a lot
And
of healthcare professionals I know use that for hand washing in between patients.
yeah,
Like that you focus on the temperature of the water, the feeling of your hand. The more senses we can engage, what it looks like. As you said, like that actually is meditation. Like it's being fully present, and we don't have to be floating at the top of a mountain with our legs crossed. It's to try find the small things throughout your day to help you. Like it just resets your nervous system, doesn't it?
yes, definitely, definitely. And there's lots of days I come home and I'm like, I don't have time to be doing that. But when I actually give myself time to do it, and really it doesn't take that long, it can make it such a big difference.
Yeah, exactly. When we think of, you mentioned the fertility journey and how our bodies change in that, I think that's such a huge topic for so many reasons. But I think these days, a lot of people are leaving it a bit later to try for babies, or maybe people have actually never thought they wanted to have kids. But if you can drift towards that time when your body is changing again, and everyone's talking about the perimenopause, and you're going, oh, should I get checked for something? Like, what if I'm infertile? I don't know if I want kids, but what if, like, 3 years' time I want kids? Do you get a lot of questions about that? Should I get tested for something? Am I okay?
Yeah,
What advice would you give?
I think one piece of advice I give is not to assume you're going to have fertility issues, because I think there's so much on fertility now, and it's really good that we're talking about fertility, and really important in terms of supporting women around fertility journeys. But I have a lot of women coming in their 20s and early 30s saying, I want to get my fertility checked before even trying. And there's some benefit, I do see some benefits from that in terms of, just from a health point of view, a moment, and every health interaction is a moment and an opportunity to make some positive changes, and possibly identify something that is medically wrong. But also it's important, I think, not to be assuming that you're going to have problems, because that can bring on a lot of stress, and stress doesn't help you in terms of getting pregnant. um, and so I should say to people, let's look at maybe the more basic testing in terms of fertility, and then do your basic bloods, especially things like thyroid. Check maybe that you are immune to rubella, or there's little bits and pieces to make sure you're ready for a pregnancy. Make sure you're taking your folic acid, and your folic acid is at a good level. Um, but I think it's really important not to just assume you're going to have a fertility problem, and maybe it is a result of so much awareness around fertility issues, which is a really good thing. But then at the same time, people then get very worried about it.
Yeah.
I find actually it's women in their 20s and early 30s who are probably worrying about it the most, whereas a lot of women who put off having pregnancies until their late 30s, early 40s a lot of those women are actually just trying to get pregnant without kind of coming in and worrying about it, because they've just said, look, we'll have a go and kind of see what happens. And then they might come in, if things aren't happening as quick as they thought they would. The most common thing I see is that people aren't having enough sex in order to get pregnant.
Okay.
Having sex every second day from day 6 of your cycle onwards, to be sort of trying to conceive, so giving it a good shot.
Okay.
The day 1 is the first day of your period, so you go 1, 2, 3, 4, 5, 6, and then after that, you need to be having sex every second day, or at least every third day, to be really giving yourself a good chance to get pregnant. And the reason for that is it's all to do with the life of sperm, and having sperm in the vicinity, and in order to, when you ovulate, there's a chance to get pregnant. But I've had lots of couples who have said that to them, and they're just having sex either around when they ovulate, or they think, or around their OPKs, their ovulation prediction kits.
Okay.
So, that you don't always ovulate around a day, and you don't always ovulate around ovulation prediction kits. And the reason we really know that is because people who don't want to get pregnant think they can have sex the days not ovulating, and then they get pregnant. And we especially see that with the emergency contraceptive pill, people come in and you're trying to figure out, have they ovulated? Will the emergency contraceptive pill work? Because it doesn't work if you've already ovulated. And so if you think about all the people getting pregnant at times of their period where they thought they wouldn't get pregnant, well, then you're more likely to get pregnant probably at times of your period where you thought you wouldn't get pregnant.
Yeah.
And it's really important to be, not focusing on just when you ovulate. If you know when you ovulate, that's great. It's actually really hard to tell. And if you use an ovulation kit, they can be kind of reassuring just to see that line comes up. But at the end of the day, it's the frequency with which you're having sex, which makes a big difference, when there's no fertility issues there.
Yeah. And women are having babies a lot older now, and very, naturally, some with a bit of help. It's brilliant to see, and it's being talked about more. Is it a question I can ask, like the oldest that you've ever seen?
50. I've seen a few women pregnant at 50 actually. Usually brilliant. Some sort of support or IVF.
Yeah.
Lots of women pregnant, not lots of women, but a few women pregnant at 50. Loads of women pregnant in their early 40s, mid 40s.
Yeah.
Well, and I think it's just a reflection of where our lives are at. Maybe it's because we've had career goals, or traveling, or we've met someone a little bit later. And brilliant thing as well. I think if you know what you want at a younger age and you meet the right person, that's great. But I think, if it doesn't happen for you at that stage, I know I turned 40 this year, and I felt it was like there was a pressure valve relieved, because I felt when I turned 30, there was this pressure to get married and have kids. And then when I turned 40, I was like, that pressure is now gone. And I didn't feel that pressure. So then, if you can kind of, not have that pressure on you, and decide yourself when you want to get pregnant, I think that's really important. I think a lot of women now are making that decision that they want pregnancies.
Yeah, it's really reassuring, and we see so many people, well into their 40s having babies, really successfully, and it's brilliant. It's really, really positive. So to reassure people listening, that it happens more than not, but obviously it's like infertility issues, it is heartbreaking as well when it's not happening for people too, and that's another stage of how to accept that. That's a really tough situation. We do come across that a lot as well. And do you find those consultations quite hard?
Yes, I think they're really hard. And I mean, I think those, we say about, having a community of support around you. And I think that's, and you and I were talking about that before. I think that's when that support is so important, because obviously there's the two people in the relationship, and that can be really difficult for each individual. And then supporting each other can be really hard. And some couples are amazing at that, and they can support each other really well. But sometimes it can strain a relationship as well, and trying to support each other when you're having your own difficulties and trying to process things yourself can be really hard. So I think in those situations, having as much support as possible from friends you feel comfortable talking to, family that you feel comfortable talking to, or more professional support can be really important as well.
GPs like yourself, pharmacists like myself, to know that we're here as well, for even just to talk about it and have a cry.
Yeah. And sometimes, I feel kind of like as a GP, a lot of people they're in maybe they're doing IVF and they're in a clinic, and you almost feel like you're so removed from that clinic that you're like the least important person for someone to come and talk to you. But actually, people will come in and just talk to you, and you're not really doing much in that consultation. Like, you're not prescribing anything, you're just talking through what they're going through. And people have said to me afterwards how important that conversation was for them. Sometimes it doesn't feel like you're doing very much, but again, it's just having that support and having someone to talk to. And especially when I do a lot about work on women's health in the workplace.
Mm-hmm.
And obviously journeys can be a really hard thing when you're working, because you might have to go off and get injections or medications or early scans or appointments, and they can be quite frequent. They could be a couple of days in a row, or a couple of weeks of days in a row. And then it's that decision, well, do I say it to my employer or not? And what do I tell them, and how much do I tell them? And that can be a really, really hard thing to think about. And I think then talking to a healthcare professional around that, especially someone who's interested, is really important. I know in the UK they've done a lot of work around looking for fertility leave. So if you are undergoing fertility treatment, that you get leave away from the workplace for that.
Because we know that's all so stress inducing, like all those conversations you're having in your head, all those wonders, should I say something, should I not? It's all building stress, and we know that stress is not going to help the situation at all.
Yeah.
Sometimes it's part of the fuel.
Yeah.
That can sometimes cause it. It's stress is a huge topic.
Yeah.
Which is why I know both of us are so passionate about the lifestyle side of things, because this is where we bring in that mindfulness, any sort of relaxation practices, the open communication with your partner, and that supportive environment to have all that around you, and really get that scaffolding there, as important as the medication and the injections you're getting. Like, it's as important, in my opinion, anyway.
Oh, definitely. Mm-hmm. Which is really hard for women going through fertility journeys, is that like your age is so, it's sort of, there's so much emphasis put on your age. If you're over 35, you're kind of as a geriatric pregnancy. I know I was a geriatric pregnancy, and the word just sounded so awful. It determined so much, because I had a difficult delivery, and so afterwards it determined so much about what happened. And medically, obviously it is important, but I kept being reminded of that every time. It was like, well, if you were under 35, we would do this differently, because you're over. It's changed things. And I certainly found turning 40, as I said, was kind of like a sense of relief. But I know, like, a lot of people do struggle to change decades and move through the decades, 20s to 30s, 30s to 40s, 40s to 50s. But I think if you can sort of, in a kind of almost mindful way, think about what you've achieved in a decade, and how those changed you as a person, and where you are now compared to where you were at the start of that decade, that can actually really, really help if you're somebody who finds that a challenge. Every year. And sometimes it's writing it down, or even, like, I love the idea of writing notes to your past self, or letters to your past self, and thinking about, well, what has changed, and where am I now, and what positive things have happened in that time.
No, that's a really lovely way of looking at things. I know we spoke before about the topic of weight loss injections, that you're getting a lot of questions about it in your practice, as am I in my practice. So we're seeing so much of it. So I thought it would be a good topic to discuss, especially when it comes to prescribing either contraception or HRT, and then how it coincides with that medication. What are you seeing on the ground?
Yes. So, obviously we see lots of people requesting the weight loss injections. Some people, their weight is actually okay, and they just want to be slimmer. And obviously that's a little bit different to someone whose BMI is at 40, 35. And, there's either already health implications from that, because they're having, either diabetes, or maybe, pre-diabetes, or high blood pressure, or fat being laid down in their liver, so fatty liver, or potential health implications of being that weight. So I think that's a challenge in terms of the two different groups requesting to go on the injections. I think they are one of the tools we have in terms of losing weight, but I think we can't lose sight of what our body needs are. And one problem with the injections is they don't address what our body needs are. And our body needs are still, healthy eating, a Mediterranean diet with lots of fiber, movement and exercise, reducing stress, addressing emotional needs. They're all still really important. They're like body needs. And I think, those along with an adjunct of a weight loss injection, then you're either going to find, like I find part of the problem with them is that they either plateau, you see the weight either plateauing, so you're not losing the weight you wanted to lose, or the weight's going back up again.
And so, yeah, sometimes if it's that cohort that you said that maybe their BMI isn't as high, but like it's not actually that unhealthy a weight, but it's just this like discomfort in their own skin, in their own bodies, and it's probably going to take more emotional work that's painful. And that's what we would love, a quick fix for things, but unfortunately it doesn't exist and it doesn't work like that. And even with the weight loss injections, just so that people know, like in all the guidelines, they're not just a magic injection, and they are to coincide with lifestyle changes, which is why, like with Pharmacy 360, we've got 7 pillars of health. If someone comes in for the weight loss injection, we're giving leaflets on nutrition, movement, exercise, stress management, sleep hygiene, all the things we spoke about. But I think one of the most important ones I've started showing customers is actually our leaflet on connections and relationships.
Yeah.
And the middle page on that is all about self-compassion and being kind to yourself, and actually just taking time to sit with yourself and not just be busy all the time. Like actually sit still. Like if you got a snow globe and you shook it up and it's all the little bits of snow are flying around the globe, and then you just hold it and let it sit, and it all just fizzles down, and you just take a breath, and then you feel like, what do I want? What does my body need, as you said? And I don't think losing any amount of weight is going to be the solution you're looking for, if that's the case. And that's hard, and that's where people potentially should ask for support, talk to someone, ask for help, or try a new class of something mindful for yourself that you'll enjoy, and just see where you get with that. But you might be at a point where you might need a bit of help, so whether it's a psychotherapist or speak to somebody, even speak to your pharmacist or your GP, just talk to somebody, I think. And do you get a lot of backlash from people? Are they very disappointed if they've come in, I want the weight loss injection, and you say, actually, I don't think that's the right fit for you? Is that difficult?
I think it's how you frame the conversation. If it's indicated and they fit the criteria, then obviously you're going to try it. There are a lot of side effects from them, so that is one thing to be telling people about, because if you start something and you don't know the potential side effects, obviously it's going to be hard to stick with it. But I think if you have a realistic conversation with things, and for me, like talking about menopause and perimenopause, like you lose a lot of your muscle mass during perimenopause and menopause, and we know on average women gain about 10 kilograms or 1.5 kilos a year as they go through perimenopause. So by the time they've transitioned to menopause, they've gained about 10 kilos. And so
we have it easy, don't we?
We have it easy. So it's, and you've got to the things like I hear a lot of people say, the things I used to do just don't work anymore. So that like crash dieting to fit into that dress doesn't work anymore, and walking 10,000 steps a day isn't maintaining the weight the way it used to. And the reason for that is our change in our muscle mass. And so incorporating a bit of resistance training when you go through menopause and menopause is really, really important as well. And then you'll keep kind of burning those calories. So again, back to that understanding and that why is our body changing.
Yeah.
And knowing that, yes, we can push you on an injectable, but at the end of the day, you're going to be either on this forever, or when you stop this, we know people regain about their weight in about 2 years of stopping it. So it's not,
unless they've implemented like a strong new routine, new lifestyle habits. And like when we talk about resistance training, just in case anyone doesn't know what that is, like it doesn't have to be in the gym powerlifting weights. Like it can be body weight exercises. So if you're on the ground, like doing a press up from your knees, or you lean against a wall and do a push up or a squat with your own body, you don't actually need equipment or a gym. It's great if you can access one, but you don't need it.
So so I tell people like floor Pilates or wall Pilates, or you can do sort of standing workouts as well. And as you said, weight as the body, or resistant bands because they're very easy to buy. Because
Yeah.
a lot of people want to go to the gym. I know, going to the gym can be pretty tough sometimes, especially when you're talking about your relationship with your body and how you feel and confidence in your body. But it doesn't have to be within a gym. It can be within the comfort of your home.
Mm-hmm.
Really important is not putting things off. So addressing health issues in the here and now. So when you're 30s, not kind of saying, well, when I'm in my 40s, I'll do that exercise, or New Year's resolutions being like, next year I'll start doing that, because the positive health changes you can make now are really important ahead of those negative health issues that can arise later
Mm-hmm.
on. So of the muscle mass loss in perimenopause, if you can, look at your exercise routine within your 30s, if you haven't gone through menopause, that's it. Most people haven't. Go through your healthy routine and start building muscle at that age, then you can just maintain it as you move through perimenopause and menopause. So I think it's more about the lifelong conversation rather than, when you're talking to somebody about the weight loss injectable medications, it's about what is the lifelong conversation. Again, coming back to that lifelong conversation, health and your healthcare provider, rather than in the moment. What
Yeah. And if people are listening and they're like, well, I'm on the injections, but I don't really know what else I should do, like ask for help. There are people out there that can be coaches, just don't be afraid to ask and reach out for that help. With the weight loss injections, before we move on, just a last point on that. A lot of people don't realize, like they most of them work by slowing gastric emptying, making you feel fuller. But unless you're actually listening to your body telling you that you're full on a normal day-to-day basis, that is a response we often ignore if we're like sitting watching the television or on our phones while we're eating. So to try to practice mindful eating is so important with that, but also to realize that they can have an impact on other things. Like there are studies at the moment that they've kind of seen coincidentally with the weight loss injections, which were actually, it was in a diabetic clinic, I think it was first noticed, about alcohol, that like people weren't enjoying drinking anymore, hangovers were worse, the pleasure from it, you can lose that. I've had people come in and say, I just don't really enjoy eating anymore, which is sad because it's such a privilege and a beautiful thing to enjoy with, especially with people. It's one of the joys of life. So it's not the be all and end all. It's amazing to help people get, this is what I tell people, to get them, if they're on climbing a mountain and you're nearly at the top, but you're just on that upward slope for years and you're really struggling, and no matter what you do, you just can't seem to get on the downward slope. And it can be great to help get people just over the hump of it, get the kind of the wheels moving, and then implement those lifestyle changes and run with it then. But like, it's not this cure, and it just, I'm so passionate that we people understand that the lifestyle factors and new habits, healthy habits, are just crucial to get the results that you want. With regards, I know you've done you were reading an article, or you shared an article recently about HRT and the absorption that can be affected from the weight loss injections. Is that something you're seeing in practice?
Yeah, a little bit. I mean, the guidance isn't entirely clear at the moment, and obviously the weight loss injections are quite new, so it was more guidance as opposed to a strict recommendation. So I think we'll have to see a little bit more what happens. The British Menopause Society came out with the sort of provisional guidance. So I think we'll have to see how that changes. But anyway, HRT is kind of always in flux in terms of what we're prescribing, because the British Menopause Society changed quite frequently. So we'll just have to see. The meeting is on in June, so I'm sure there'll be a talk around it. Main meeting. But I think the main advice is just to talk to your GP if you're on HRT, and taking it. Make sure your GP knows you're taking an injectable weight loss medication in case you've got it from a different clinic, or if you've got HRT from a different clinic and you're on an injectable. Just make sure both clinics are both those medications.
Yeah, just in case the dose needs to be tweaked, or it's just good you need that knowledge to be able to make an informed decision, really.
Yeah. And also the same in terms of contraceptive as well. It's important to talk to your doctor if you're on the contraceptive as well, especially because people sometimes do find it challenging to get pregnant when they're maybe overweight or obese, and then as the weight comes off, suddenly their fertility kicks in. So we've had a few people get pregnant on the weight loss injectable medications who weren't expecting to get pregnant.
Oh, as in were they on
Not,
contraception as well? And
yeah. And now, luckily, they were pregnancies that they wanted to happen,
yeah,
so it was great. But it just you'd be a little bit careful when you're on the medication in terms of getting pregnant. So again, if you don't want to get pregnant or you're planning a pregnancy, and you're of a sort of pregnancy age up to the age of 55, just to talk to your GP or doctor around that, because that's important consideration.
I love that stat that like you are fertile. Most people can be fertile up until 55. Like I think a lot of people don't even believe it, but it is.
Yeah, when you say the FSRH says 55, so when you say to people, they look at you like you've got two heads. Now, obviously, there's a few caveats to that as well, but that's the general guidance. If you're still having, especially if you're still having regular cycles, obviously that makes that's really important.
Yeah, yeah. And with regards to HRT, and I know that was like a big kind of you've been amazing with educating around that. I know there's a website if anyone wants to have a look, informed.ie, and it's all about like you're an advocate for making sure the whole community, the family unit, the men, the workplace, everybody is aware of these changes that the women in their lives are going through. And what have been the best sort of outcomes for you, and like the biggest change in the last sort of 5 years that you've seen that you're really happy to see?
I think it's probably awareness around, people going into perimenopause and menopause, because I think up until now, it's been quite confusing. And I think even like doctors make it confusing sometimes. People go to their doctor and they say, "Oh, I think it's menopause," and the doctor says, "No, you're the wrong age," or "We need to do a blood test for that." And I think, I think our awareness, even as health care professionals, has grown. But I think women as well, that they now recognize themselves into perimenopause and menopause. And then say, I think it is the perimenopause. What can I do about it?
Yeah.
Like central piece to the work I've done. It's been all about, how can you present this to somebody and say, look, I think it is the perimenopause. And there's lots of menopause checkers out there, which you can sort of look at all the symptoms and check off what you think are what your symptoms you're having, and then kind of say, well, I think it is menopause.
Yeah.
So I think even the awareness, and then I think menopause in the workplace. Again, I do a lot of. I'm very interested in women's health in the workplace, and I think that's really something that's taken by a lot of companies now have menopause policies. Will do run menopause webinars or workshops within their own companies, or they'll like one of the banks has menopause leave now 10 days since 2022. And what I love to see is, because I do quite a few menopause workshops for companies, is at the end of a talk when the men all come up and ask lots of questions. I think it's really good. And the more talks I've been doing, particularly in the last, those men coming up to me asking about the menopause, asking about maybe their wife or their sister or their mother. And I know one of the workshops I did last year for World Menopause Day, it was like 50-50, half men, half women in the room. So that was really lovely to see. So I think, there's that lovely change in that women are beginning to advocate for themselves, and men are actually getting an interest in it, and a growing interest in understanding what's happening to women as they transition through menopause. And I think that's really important, because that kind of translates then to hormonal health.
Yeah.
So things like endometriosis or fertility problems or
PCOS.
period PCOS. Exactly, yeah. Like in March was endometriosis awareness month, and I had two male friends ring me about their either female halves or friends asking me about endometriosis just for their knowledge, or asking me could I ring that person and talk to them about their endometriosis and just kind of help with information, because I think endometriosis one, menopause, it's we're talking loads about menopause, and there's never enough. Like even the workshops I do when I go out, people can still be confused. So it's there's never enough information. It's always reliable information. It's really important to always be giving out reliable information.
Mm-hmm.
But when we're still it's still one to work on in terms of raising awareness around endometriosis. And I think it's one of those ones where people are still women are beginning to recognize when they're going to perimenopause and menopause. But I think a lot of women, it's still, it's hard to know, it's hard to recognize it's endometriosis. So I think awareness around that is really important. So it's really nice to see
all
male
these
interest in that and wondering what it's about.
brilliant. No, it is brilliant. And when we think of at like whatever stage it is, if there's medication involved, is there one particular lifestyle pillar that you kind of preach about the most in your consultations? Would you think one is like more important than the other? Like when we think about sleep, stress, nutrition, exercise, movement, what's the kind of the one that comes up the most for you?
The one that comes up the most is the least sexy. It is fiber. Um,
With nutrition, yeah.
Exactly. So getting as much fiber in your diet as possible. We're supposed, as females, we're supposed to get about 32 grams of fiber in your diet a day. For men, it's probably more up on like 36, 38 grams. I kind of round it all to 30 grams because most people in our end get between 7 and 15 grams of fiber. So if you just round it 30 grams and try and get everyone to get 30 grams, it's a nice round number. And if you you're doing pretty well considering the average is 7 to 15 grams.
Yeah.
And fiber is really important in terms of lowering cholesterol and blood pressure, but also really importantly in terms of filling you up. So, we're giving weight loss injectable medications to like reduce your appetite, but actually if you eat lots of fiber in your diet, it helps fill you up. So it's going to sort of stave off your appetite naturally.
Yeah.
Really, really good for weight loss. If you want your hidden trick weight loss, fiber is that one.
And water.
Yeah. A lot of people come to me and they say, I'm back for my blood test results and I know you're going to give out to me. You're definitely going to give out to me. And I think that's like an expression of probably inner guilt about what that person is, doing to their body in terms of consumption and things like that, because I never give out. But for me, it's not always about taking away. I'm like, I love my little bit of chocolate and my glass of wine every now and then. But adding in can make a big difference. So adding in fiber is really, really important. So, if you can add in fiber to your diet and things you're eating throughout the day. So, your porridge is very high in fiber, but, given that most of us are getting 7 to 15 grams and we need 30 grams, then add in more fiber to your porridge. So adding in your blueberries, your chia seeds, your strawberries, they can all help. And then same at lunchtime, like, adding in a bit of fruit at lunchtime. And frozen vegetables are my favorite thing in the world. They have this, the same nutritional efficacy as fresh vegetables, but you can throw them into anything. I know I have the tiniest fridge in the world. I wish I had a bigger fridge. And so I find it really hard to have fresh fruits and vegetables. So I just have loads of frozen vegetables in my freezer at all times. And I just add that to everything.
Yeah.
If you don't like frozen fruits and vegetables, if you just got a chopper and chop it up really small, and that's what I do with my daughter to hide the vegetables, or used to. We used to hide the vegetables, chop them really small, and then put them into your bolognese, put them into your lasagna. And then, like, you're not like just eating like salad leaves, you're not even living off like a bunny's diet, you're still having nice foods, but you're adding in fiber and adding in nutritional value that's really going to make a difference to you in terms of your health, but also your weight is, a little bit what we're focusing on this evening as well.
Yeah.
So for me, my number one thing, and no one leaves my room without a fiber conversation.
Brilliant.
Back to me, I'm like, did we have the fiber conversation last time?
Brilliant. I love that. And it's like the great thing about that is it's really simple. It's just the education around it. So once we know, then you can act on it, and you don't like it's very easy to add a spoon of this, add a spoon of that, and that add in. And then naturally the kind of the foods that we were trying, like craving, the more sugary stuff, they will filter away because you're fuller, like you're just fuller for longer.
And adding in rather than taking away, I think it's a really important message. And that's, I'm not going to give out to you because I don't give out, but also I'm not going to tell you to just give up everything. I'm going to say about adding in rather than taking away, And I know webinar for the Irish Heart Foundation last year, and I was banging on about fiber on the webinar. And the dietitian with the Irish Heart Foundation came to me afterwards. She was like, "Oh, you're the fiber queen. I'm delighted to hear fiber."
I know. And it's so simple, we just forget about it. But I know it's something like 80% of Irish people are not eating enough fiber. And shocking. And if someone really is struggling like with the food element, like we do sell an amazing product called Silly Floor, which is like soluble fiber, and you can literally put a spoon of it on anything. It comes in loads of flavors, but it even comes in a plain flavor. So whether you're having like soup, yogurt, a
Yeah,
salad, you can literally sprinkle it onto anything, provided you're drinking enough
yeah.
water. And it's there are ways around it if you kind of you're like I'm struggling with this, I can't seem to get enough, like come and talk to your pharmacy team, because we've loads of ideas around that as well.
Absolutely. And also,
Yeah,
it can be inexpensive as well. That's the other thing about it. It's not, it's not an expensive thing to be buying and adding in.
yeah,
It's make it inexpensive, which is really important because obviously, things have got so expensive now. Life has got so expensive. Cost of living has gone so high.
yeah.
So it's a simple change you can make with minimal cost as well.
Exactly, with maximum gain for yourself. Yeah.
And it is
And I think bring
an,
up
an,
sorry, go on.
an apple is 4 grams of fiber, so you need up on 7 or 8 apples in your diet, or equivalent of other fruits and vegetables in your diet in a day to get enough fiber. And I know I tried this myself. I was like trying to get 30 grams of fiber in my diet, and I would have count myself as relatively quite a healthy eater. And it just meant I was eating so much more. So you really do have to make a conscious effort to do it. But when you do make that conscious effort, the rewards are really there.
And then you want to continue it, so you get that positive
Yeah.
like the response that that's what new habits, that's how you create new habits, and for the better. Well, that's super. I feel like we've gone a little bit over time, which I kind of knew was going to happen when you and I get together. But thank you so much for everything. It's been really, really brilliant. I hope people have benefited from it and enjoyed it. And we will save it, but if anyone wants to watch it back or missed some of it, it will go up on YouTube hopefully in the next day or two. So it's a lot easier to listen and pause and play there in your own time. So thank you so much for coming on. And yeah, I just want to also mention, if anybody wants to hear more from Louise, you have a podcast. You're a co-host on the Lady Bites podcast, which is on Spotify and probably other
Yeah.
podcasts.
Usual podcast channels.
Brilliant. So yeah, that's like loads of small little podcasts about educational pieces around women's health, really, isn't it?
Yeah, bite-sized episodes on women's health. Basically, that's where the name came.
Well, everyone go and subscribe and check her out because she's brilliant. So thank you so much for coming on.
Well, thanks for having me on. I really enjoyed it, and as you said, we could chat for hours.
Yes, exactly. Well, have a lovely evening, and thank you, everybody. And I will talk to you soon.
Thank you so much. Take care. Take care.
Bye. Bye.
Bye. Bye.